I believe everybody has good intentions. A lot of times doctors don't communicate well enough to explain. And that's why we have this, I mean, my practice is up there. But this appointment is so important to me to be able to communicate to you, because if we don't start off on the right foot here, if I don't communicate right, it sets the precedence for everything moving forward. And so a lot of doctors, they're moving so fast because they're running and gunning between patients, and they have to go see 3 hygiene, and they have to go run over here and do a filling. And so oftentimes they get into conversation, but they give about 5% of what they want. And so that's why I have a team of doctors up there that are working, and I'll go from here and I'll drift from here to there a little bit. But these appointments are really important to me because this is where we set the tone of how important it is. If you're going to make this big decision to take your teeth out, and like your son did, a few years back, we want to make sure that you understand the good, the bad, and the ugly. And we don't do a lot of ugly here. We don't do any ugly. But at the same time, we want to make sure that people understand what the experience is going to be like. And like a denture, for example, it can look beautiful. And if that's all you're going for is just a good-looking set of teeth, then I could deliver on that. But the second you start to say, well, I also want to chew, and I also want to feel like a human, and I also want to feel sexy, well, there's no one that I know that can have all those things with a denture. Sometimes we'll have to go into a denture because literally their finances allow nothing else. But I'm the type of guy that if I see anything that can wait, I would rather someone wait and keep even 4 or 5 teeth and struggle eating, because those 4 or 5 teeth will still be better than a whole set of dentures. And but anyways, if you guys end up liking your consult day, you're welcome to send them down, and I'll be happy to see if I can help them. I do have a lot of patients that come in that have been in dentures for a few years, and we take a CT and we look at the bone. We do the same thing we're going to do here, but we'd see if he's a candidate to be able to put some implants in. Most likely, there's a very good chance that he would still be able to qualify for implants. Like I said, once you take out teeth, see how much the bone changes? So with him being in his 30s and he lost all of his teeth, the longer he waits, the harder it will be to get implants in. And so I would at least tell him, go in, find out where you're at in your bone loss history, and so you can kind of make a plan. I've told people to come in at times just to, even if you had to put implants in just to anchor some bone in with the idea that you had to hook them up later, that might be a fairly good plan.